Hello, I'm Dr. Wiśniewski and I want to welcome you to my channel Neoped Edu. In this video today, I want to talk about a book I wrote for parents and families of premature babies. The book's title is Babies Born Early, a guide for parents of babies born before 32 weeks of gestational age. First of all, who am I? My name is Dr. Wiśniewski and I am neonatologist. I work clinically as a neonatologist in various hospitals in Illinois and Chicago area. Throughout my career, I worked both in university hospitals and regional and smaller hospitals in different states in the United States. By my accent, you may think that I am a foreigner, so yes, indeed, I was born in Poland. I finished my medical school in Poland, but then I got trained as a pediatrician and neonatologist at University of Illinois in Chicago. I also obtained master's degree as an educator in medical education. Why I wrote this book? For whom is that book? So, throughout my career as a neonatologist, I noticed that many times parents search for more information. They sometimes don't trust the doctor with whom they interact, or they want more information that they received, or they want to get another view, different opinion, or they just want to get general idea about conditions that their baby has in order to be able to ask better questions. Also, I realized that a lot of materials written for parents are written on the level of 5th grade, because often that's a requirement from governmental authorities. Fortunately, as a writer, as an author, I can decide how much information to put in my book. And I decided to put a lot of information in my book for parents of premature babies. I think that they deserve to know more. Or I realized that majority of parents and families that I interact with, they want to actually get the full picture. I think that this book will help you to ask better questions from your doctors who are treating your precious little baby. As I said, this book is for parents and families of premature babies who are currently staying in an ICU and receiving treatment. Also, this book is specifically written for premature babies who were born at less than 32 weeks of gestational age. Why I am making this distinction? It is for the reason because babies who are born at less than 32 weeks tend to stay in an ICU for several weeks, and the tiniest ones even for many months before they can go home. During that period, during their stay in the hospital, they undergo many different procedures. They receive different treatments, and obviously families want to know a lot about those conditions and treatments, and they ask a lot of questions. I think that my book will help you in that journey. Now, where can you find this book? This book is available in digital format on 3 platforms: on Amazon Kindle, on Apple iBooks, and on Kobo. I strongly encourage you to buy digital format if you are okay with reading books on iPads or other different digital assistants. However, if you want paper format, you also can order that. It is slightly more expensive than digital format, and it is available on Amazon.com. As you can see, there is paper format of that book that you can also find. Now I want to go briefly over contents of that book so you have confidence if you decide to buy that it will be useful for you. I will go first through digital format that is available on Kindle, and as you can see, the cover is the same as in paper format. And let's go to contents, and as you can see in that table of contents, there are 25 chapters, And don't be scared, they are not very long. Each chapter you can read probably over 5 or 10 minutes, maybe a little bit longer, depending on your level of education and how carefully you want to read. And if you use digital format, you can just click on any of those chapters and it will take you directly to that chapter. So it's very easy to find information that you really want to find. Also, chapters are interconnected. If I interlink certain information from one chapter to the other, you can directly jump from one to the other. Now, you can see that I started book with introduction. Then in chapter 2, I give you explanations. How is the best to use this book? What does it mean? I tell you what chapters to read. For example, if you are pregnant, if your baby is not born, but you are worried that your baby will be premature, so how to prepare yourself perhaps for that time of birth when baby is premature. So you will learn about definitions of prematurity, what are general problems that premature babies tend to have. You will learn a little bit about NICU and so on. So as you can see, the following chapters are telling you, chapter 3, I have premature baby, what to do now? A lot of parents are scared. They got premature baby. They don't know what to do. What to do next? I give you some tips how to talk to your neighbors, how to talk to your family, how to deal with that baby being born, what to do with childcare. I will give you a list of some items to think about and what you should do in situations like that. In chapter 4, I talk about prematurity, background information, what are definitions of prematurity and causes or situations in which you might have premature baby. In chapter 5, I talk about neonatal intensive care unit, what that entails to be hospitalized in NICU, what kind of equipments we use, what are levels of care of NICU, because not every hospital is equipped well to take care of your baby depending on complexity of conditions that your baby is affected by. So those are all important informations. Next one, chapter 6, I talk about normal, in quotes, routine newborn care. What that means? Every newborn baby, full-term baby, healthy newborn baby receives some type of health care after they are born in the hospital. This is not different for premature babies. There are certain procedures that I always done to newborn babies after birth, and I talk about them. In chapter 7, I talk about very important issue, kangaroo care. Kangaroo care allows mothers and fathers to bond better with their baby and helps mother with breastfeeding, helps them to stimulate their body, their hormones, to start producing breast milk, which is the most important medication for their babies. So it's a very important procedure to learn about kangaroo care. In chapter 8, I talk about respiratory distress syndrome, which is a condition affecting lungs in premature babies. In chapter 9, I talk about apnea, which is common among premature babies. It's a condition when baby stops breathing. In chapter 10, I talk about jaundice, newborn jaundice. A lot of premature babies develop that condition and they need to be treated for that. In chapter 11, I talk about important complication of lung problems, which is called BPD, or bronchopulmonary dysplasia. This condition that affects many babies and makes them being dependent on oxygen for a prolonged time. In chapter 12, we talk about nutrition, fluids, and how we manage feedings in premature babies. In chapter 13, 14, 15, 16, 17, and 18 and 19, we talk about various complications that can occur in premature babies. Doesn't mean that your premature baby will have any of those or all of those, but those conditions are important to be aware of, because if they occur, sometimes they can be very severe or dangerous to your baby, and some of them may require even surgeries. So it's a good idea to learn about those. Talking about that, I also wanted to click here on the chapter 16, retinopathy of prematurity, and show you that I also include some graphs when I explain different problems affecting newborn babies, and I give you tables with data about statistics and so on. So there is a lot of important information in that book. Now, if we go to chapter 20, I talk about different diagnostic and therapeutic procedures that we do on newborn babies in NICU. In chapter 21, I talk probably about the most important question that parents always ask me. How is their baby gonna be doing in the future? How they will do? Will they be okay? So we talk about outcomes of premature babies. In chapter 22, we talk about special situations such as genetic syndromes or congenital anomalies. Being a premature baby doesn't mean that genetic conditions cannot occur. They do occur as well, both in full-term and premature babies. So it's a good idea to have a little bit of knowledge on that subject. Finally, in chapter 23 and 24, I talk about when your baby will go home and how to prepare for that moment. So, as you can see, there is a lot of important information in this book. If you think that you may benefit from that information, I invite you to go to Amazon, iBooks, or Kobo and purchase your book. Thank you for your attention. Goodbye.